Hi, my name is Jim. We came to see Dr. Jowdy. I brought my wife Karen because we were in a world of hurt, I guess you would say. Karen had experienced a very long, slow decline in her ability to walk and to stand straight. And we had been to several different doctors for different reasons. I guess one of the first things that she had was bunion surgery, and that was on both feet, if I remember right. And that resulted in a pin being put through her foot to hold the bones together, because I guess the surgery didn't do exactly what it needed to do. So she still has that pin in there. And there were different problems in addition with ankles and knees and things. So over the course of 25 years, we saw her ability to walk in a normal fashion with a normal gait just slow down, slower and slower. Initially, she needed some hand holding, and the hand holding increased. She found it difficult to cover uneven terrain or tilted terrain when the walkway wasn't straight and flat and simple. And then she decided that a cane was necessary for additional support. And after the cane, we realized that a walker would probably help, so we started using a walker. She had been to several doctors, podiatrists, and chiropractors who tried to help. We thought it was foot-related or leg-related, but we didn't realize until we came here to Dr. Jowdy that there was a brain issue. And after coming to see Dr. Jowdy, he did an evaluation, and we got a diagnosis of basal ganglionic disorder. And we realized that all of the problems with the feet and the ankles and the legs were symptomatic. It was the brain that was causing the problem. The brain wasn't firing right, and the bones and the muscles weren't getting the right message, and that's why she was starting to suffer and decline. So what we saw Dr. Jowdy do over the course of 1 week and then the next 2 weeks was what he calls functional neurology. And we liked it because it's non-invasive, there's no surgery, but it's kind of his magical touch, working the organs, working the head, and it's just a remapping and getting the brain to fire the proper signals down to the different parts of the body and the muscles, so that the muscles can relearn and do what they need to do. And it's been a refreshing, happy, wonderful thing to see her stand straight, number one. When we came here, she was using her walker, and yes, she could get by with the walker, but it was very slow. She was bent over. Her posture was terrible. Even standing while not using the walker, the posture was just, it was uncomfortable just to look at because she couldn't stand straight. But after 3 days, I could see her standing straight, and that was just, I almost wanted to cry when I saw how straight she was standing, and that was just 3-4 days into things. So that was wonderful. And then she started to walk slowly without the walker, and we're working from that point going forward, trying to continue the unassisted walking. Many times when we'd be riding in the car, Karen would say suddenly, I need a bathroom. And we would have to pull over and stop and find a bathroom so she could tend to her needs. And that situation became more frequent as time went on. And it appears that is starting to correct itself as well. And she's feeling much more bladder control, and that gives you more confidence that you can do all the things that you need to do without having to worry about it. Yes, all of this was in a 2-week period, 10 treatment days, right? To the folks out there who have seen many different doctors and are not finding the results that they want, I would say, come to see Dr. Jowdy. He, as a functional neurologist, will not use conventional methods, and they may seem very unusual. But that's just because we're so indoctrinated into conventional medicine that we feel that something has to have drugs, it has to have surgery, or this person isn't a doctor. Well, this is a very different, as my daughter would say, out-of-the-box approach, and it works. It works. I've seen it over the course of 2 weeks. I've seen improvement. No surgery, no drugs, just some outside supports in the way of diet. But this is working, and I think it can work for other people. If it works for my wife, it can work for other folks too.